Health is wealth. Definitely the greatest wealth we can possess in our lives. Good evening. Welcome to today's episode of BMC Global Live Hilal Health World. In today's episode, we will be dealing with the topic fatty liver. Myself, Mareena Francis. Before we move on in depth into the topic, reminding all of you, please make sure to like and share BMC Facebook page and subscribe to our YouTube channel for more such informative episodes. Joining with us today in today's episode of Hilal Health World is Dr. Suresh D, a consultant in gastroenterology with a vast experience of 24 years. He has completed MBBS from Madras University, MD in General Medicine from Dr. MGR Medical University and DM Gastroenterology from Dr. MGR Medical University. He is currently working at Al Hilal Hospital, Muharrak branch, and we are very happy to have him with us today. So let's know more about the topic from him. Good evening, doctor. Welcome to the show. We are very happy to have you with us in this episode today.
Good evening. Thank you so much.
Yes, doctor. Doctor, so today's episode is on the topic fatty liver. So let me start with the basic question. What is fatty liver? How can you elaborate?
See, liver is one of the largest organs in the body. It is endowed with huge capacities and responsibilities. It deciphers the food materials we eat in the intestine and absorbs them, digests them and stores them. It also has the capacity to remove the toxic substance away from the blood. So it's a very huge, important metabolic organ, and its function is central to the digestion in the abdomen, central to the gastroenterology itself, and it is very useful for most of the functions of the carbohydrate, protein, and lipid metabolisms. And whenever the liver is having any problem, you invariably affects all parts of the body, it affects the entire health. Yes.
Okay, doctor. My next question would be, for this disease, fatty liver, what will be the symptoms of the disease?
Yes, fatty liver is a very common occurrence in present time for a long time. But with the advent of ultrasonogram of the abdomen, many people now last 30-40 years were undergoing ultrasound abdomen very frequently, commonly, for multiple reasons. The fatty liver has come to the forefront. Now anybody can go to any hospital, do an ultrasound abdomen. One of the commonest findings will be mild fatty liver. That is how the fatty liver comes into the prominence. That is how the fatty liver comes to the knowledge of the patient and the doctor. Fatty liver is most of the time asymptomatic.
Okay.
Patient does not know. It's a silent disease. Okay. That is why it's very important. First, your disease, if it has some symptoms, immediately the patient will come to the doctor. Sir, I'm having this problem.
Yes.
I'm having headache. I'm having joint pain. But fatty liver is a silent disease. Okay. Only during ultrasonogram or when you do your blood test for some other diseases, you go to the doctor. That time you look into the liver function test. You can see in any laboratory results, there will be liver function test, LFT. You will see some changes, abnormalities. Then the patient will come to the doctor, or the doctor will tell the patient, both ways. Your liver functions are not okay and your scan is showing a fatty liver. That is how it gets to know most of the time. Only some people may come with tiredness, weakness, body pain, some dull. The liver is occupying the right upper quadrant, extending it to the little part to the left. Some people may come with some ache, dull ache, etc. Sir, I'm having some pain here. Because of the weight it pushes, no. Okay. Otherwise, it is most of the time a painless disease, the early stage. That is why the emphasis is you should detect early, because silently it can progress. And most importantly, fortunately, this ultrasonogram abdomen and liver function test or other related blood tests we do frequently. Any reason, you go for consultation with the doctor for fever or something, they do many of the tests. That is how it comes into the notice. Most of them asymptomatic. Sometimes some vague symptoms which should not be easily related to the fatty liver. But in late stages, you can have lot of symptoms, all signs of liver disease like jaundice, fluid collection, foot edema, swelling of the feet, so many, and tired, those things can come. But most of the time, early stages for long duration, it is almost silent. That is the stage we have to pick up. That is the stage you have to investigate. That is the stage we have to treat, so that it doesn't progress into a late stages where the treatment will be more difficult.
Okay, doctor. So, as you said, this disease is a little bit difficult to diagnose in the early stages, isn't it, doctor? So, you may suggest that frequent medical checkups or frequent medical tests would be helpful.
Yes, periodically people undergo a checkup either annually or when they change a job or when they have some symptoms. They go a total body evaluation or evaluation for heart or lung or abdomen. Mostly these diseases come into the fore. Okay. And once you pick up the problem, it is very essential you consult a doctor, evaluate the reasons in that particular patient, what is the reason for that, and try to reverse it, treat it, and become normal. Instead of allowing to progress into late stages where liver failure, complications, and maybe expensive treatments, side effects, plus you may even go up to liver transplantation. So it is very important you pick up the early stage and immediately you correct it, reverse it, you become normal. It is just like eye checkup. You wear a specs and you become better.
Yes, okay, doctor. So, as you said, if it progresses to the later stages, it may become a bit dangerous for the patient.
Yes.
So, can I ask you to elaborate on how this disease affects the health of the person?
As I told you, the liver is the headquarters of the metabolism and digestion in the abdomen. When it starts failing, whenever there is excess deposition, what is fatty liver? Excess deposition of fat in the liver. Normally it is 5 to 7% of fat in the liver. But when there is excess fat in the liver, what happens? The liver is under stress. It is unable to handle it. Initially it gains weight. Then it starts showing signs of inflammation, jaundice. Then when you don't recognize the symptom, you just allow it, it starts destroying the individual cells, fibrosis, and you still ignore it. It further goes into start shrinking like a old fruit, dry fruit. Fruit is big. Once it becomes dry, it becomes wrinkled and small. Yes. So the liver will become shrunken, cirrhotic, and become small, underfunction. When the underfunction, still you manage to live. Some people don't know even that stage also. Then it decompensates. Till now, whatever difficulty in the liver is compensating. When one hand is not working, the other hand is making up like that. But the stage comes, it cannot compensate, decompensation. Then it cannot remove the water from the body and the abdomen. It will become big. The feet will become big. You can't pass much urine. You have jaundice. Then you start having vomiting and sometimes vomiting blood. And slowly, as I told you in the initial stages, the liver removes the toxic substance from the liver, blood. Yes. When it is not functioning, it cannot. So the toxins are left in the blood. And toxins in the blood will move all over the body. Brain will be affected, kidney will be affected, the lung will be affected. Breathing difficulty will come, urine will not come, and the patient becomes slowly sleepy and becomes coma. It is called hepatic coma. He becomes unconscious. So these stages, of course, take long time to go. Okay. Do not be scared. The fatty liver, today you see the scan, tomorrow it take long time. But when you see in a scan or a liver function test abnormalities, immediately go to consult a doctor, do a thorough evaluation, find the reason, remove the reason. 90% of the time it will be removable reasons will be there. 90% of the time you can reverse it. But only 10% times there may be something unusual which may need a prolonged treatment. The aim is not to reverse it, even it progresses from stage 1, 2, 3, 4, 5. At least make it very slow so that it progresses late stage, very late age. Okay. That is the motive and motto of this fatty liver.
Okay, doctor. So, doctor, you mentioned when you said about the side effects that the disease has, we would definitely like to know the reasons behind getting such a disease. You also told remove the reason is one
Yes,
option.
it's very important and very common also. Very common also. There are two kinds of fatty livers. For a common man's perspective, there are two reasons. One common reason is alcoholism.
Okay.
Drinking alcohol is a very easy, say, liver toxin. The alcohol is called not alcohol in the textbooks, it's called liver toxin. It is a toxin to the liver, enemy to the liver. So alcoholism is one of the commonest cause. You can see alcoholic people some people do it too much and get into diseases, the liver is affected. You can be heard like that. Second is those who do not have alcohol. There are a lot of people, ladies are there, many people are there. They get disease because one, overweight. Obesity, some people have huge weight, so morbid obesities, sugar, diabetes mellitus, and uncontrolled sugar. Some people sugar values are very high. Cholesterol, that is lipids. Cholesterol is one of the lipids. Triglycerides, excess amount, either because of the eating or by nature, by genetically. And you can see some people having triglycerides very high, 300. Cholesterol 300 like that, triglycerides, overweight, sugar. Some people like who have underactive thyroids, sometimes pregnancy can trigger it. Some people they have to take medicines for a long time because of some other diseases, anti-epileptic medicines. Those are fits. They have to take medicine for a long time. Those who have some immunological mediated diseases take some doctors are giving medicines, but they have to take it long time. It will affect the liver. There are a lot of medicines are there, toxins are there, unknown. Some food you take which does not suit you, toxins are there. Some infections like virus, hepatitis C, you might have heard, can also produce fatty liver. So the lot of enemies attacking the liver, but the common is alcohol, excess weight, diabetes and cholesterol. This is very common, diabetes, cholesterol and all. Once you fall, overweight also you can see a lot of people, particularly the truncal, tummy, central obesity is very important. Will produce a fatty liver. Once you find these reasons, treat it aggressively, reverse it, then most of the time it will not progress further or it will reverse itself. And in the process, your liver is saved.
Yes, yes, doctor.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും. ലുലു മണി, സ്നേഹപൂർവ്വം.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dancers, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. iMAC, Cochin Kalabhavan.
So when you mentioned that, there's another question that comes to me. After treating many patients with this for these many years, do you find the difference in the number of patients in different age groups, or maybe more number of males or females? Is there a difference like
Alcoholism more in favor of males.
Yes, yes.
But other diseases are common.
Okay.
Even in the females, it is more common after the menopause rather than before. But gents, any age you can get it. And present dietary styles, fast food, taking food, very highly carbonated food, drinks, young people also have it.
Okay.
Young people also now they are used to this chips, so many items they take, fizzy drinks, fast food, which is very common among the younger age group.
True.
So young people also get fatty liver, but they have the body to time to go about it, to approach it in a proper way to come out.
Okay.
This is an early disease. Fortunately, fatty liver, early stage you find it, you correct it sincerely, professionally, you get reversed, or it does not cause you any further problem.
Okay, okay, doctor. That was a good point that would create awareness among the viewers today. And doctor, now once we know about the reasons that may cause fatty liver, how would you evaluate a patient with fatty liver?
As I told you, many patients, because of the lack of symptoms, mostly patients don't come to you, and we don't approach liver disease. By chance we find an ultrasonogram or any blood results, then we start evaluate. The patient comes to you and we tell them this is the problem. He agrees to go for further evaluation. We go for a complete blood checkup, ultrasound abdomen, CT scan abdomen, MRI abdomen. If the stage of liver disease is slightly, we suspect has gone little further, endoscopy to see internal changes. And all the markers, as I told you, sugar, lipid profile, thyroid, body mass index, everything we evaluate. Sometimes some trick hepatitis C, I told you, and thyroid. Any diseases we think can produce. When we see one by one, you are not a sugar patient, okay, leave it. Then we go for, okay, you are not there. Then we go for next choice. We go on evaluate your diet. We ask you to write what all your normal eating style. Then we find anything wrong, we try to remove it. Like one by one, we keep on eliminating. Okay. So mostly we will catch it. Okay. Somewhere we catch it. Otherwise, very rarely a patient has no reason just to get a fatty liver. That happens in small proportion due to genetic reasons.
Okay. So doctor, after evaluating the patient in this manner, how do you manage this fatty liver?
Excellent question, because these kind of programs I want to emphasize to the people. Even you don't come to the doctor, you are very busy. Okay. Or you are having some other disease, so you are not concentrating on this disease. Okay. Or you have some other work. Still, I have given you the list. First thing is overweight. Yes. So best way to reduce overweight is activity. Yes. exercise, walking, running, jogging, swimming, climbing the stairs, doing all the work yourself instead of asking somebody, please bring this one, that one. No, you yourself go and do the work. Activity, that is the first thing. Very easy to bring down the weight. Diet. What is diet? How to manage diet to reduce weight? You go for vegetarian, vegetable, plant-based diet. Fruits, vegetables, rather than meat. Even in the meat, prefer fish, remove red meat, fat-laden food. You avoid all this saturated food, these carbohydrates. They have a role in the glucose and fatty items. You remove all these things. First, the exercise that anybody can do without even consulting a doctor. Simple exercises. Diet control, anybody can do without. If you are a diabetic, check whether you are controlling it properly. Then you consult a doctor. If you are a cholesterol patient, see your values. Then consult a doctor. You are a thyroid patient, then consult a doctor. Suppose you have some other food habits, you yourself know that from what I have taken. Fast food, all those things you can do it yourself without even considering a doctor. And remember, the treatment for sugar is diet and exercise. Treatment for cholesterol, diet and exercise. Treatment for fat, diet and exercise. And most importantly, if you are an alcoholic, stop it. Whatever is the reason, you stop it. Otherwise, it will progress. You stop it and see 2-3 months itself, you will see a lot of improvement in the laboratory values and your body. And you follow it rest of the life, you will have a royal, comfortable life.
Okay, doctor. So when you mentioned that, another question I would like to ask is, can we get rid of this disease completely after proper treatment?
Yes, very much so. That is the aim. Fatty liver at a very early stage, if you recognize it, even coincidentally, you have to evaluate, and if you undergo all the medical advices, you will thoroughly get rid of it. Totally reversible, not like 1 or 2 days, over a period of time. In the early stages, it is very easy, very simple. Diet, lifestyle modification, exercise, find the underlying cause. If you have any obvious underlying cause like sugar, blood pressure, cholesterol, thyroid, all those things, you control it better. It will always be safe for you to assume it will be all right. But if you have unusual cause also, it is possible to reverse it as much as possible, or at least will not allow it to progress. As long as it is remaining in stage 1 great fatty liver, nothing will happen.
Okay, that is a good note, doctor. Now I would like to ask you, what is the future of this disease?
Future is very bright. As I told you, future is very bright, but you have to pick it up at the early stage. You have to be aware of it, because the silent, painless disease, nobody will bother. You so fatty liver, okay, no problem. Because I came for some other complaint, and you have to be sincere and accept there is small problem maybe. Go to the doctor, check up regularly, have a complete evaluation. Medicines are available. In patients whom they have progressed from little stage to further, all these measures, that is diet, exercise, lifestyle modification, so all the things, diabetes control, sugar control, cholesterol control, thyroid control, all the things we have done. Removed the virus, we have removed the infections, we have changed the food diet, we have done everything. Still it is not yielding satisfactory results. There are medicines available. For alcoholics, there are medicines. Non-alcoholics, there are medicines. You can take the medicines for a period of time. You get reversed. There is availability. It is an easy disease to treat, easy disease to reverse in most of the patients. Unless they are come with some very severe diseases, very severe causes, very bad causes, most of the people are okay. But you ignore it, you go to stages 1, 2, 3, first, next is hepatitis, then steatohepatitis, NASH, then go to fibrosis, cirrhosis, then decompensation I told you, then some people rarely cancer, and then it becomes very difficult to handle it. So the future is very bright as long as you understand it and pick it up and come at the early stage.
Okay, doctor.
And you yourself do 90% treatment.
Yes.
Diet, exercise, walking, and stopping alcohol, very important. Those who are drinking alcohol, those who are not drinking is not much. Those who are drinking, stopping alcohol, and you are having obvious disease of yourself. You know that you are a diabetic, you are a patient, you know also you are overweight, friends are telling you. You attend to all that even before going to the doctor. You are holding the horse. They understand this.
Yes, definitely. Doctor, you provided many advices for our viewers. Just to give them a sum up of today's talk show, can you give one takeaway message for them in short?
You have to concentrate on your diet and lifestyle, everybody. And this is not for fatty liver, also for sugar, diabetes, cholesterol, heart diseases, all the complications like brain, kidney, all are related only. You go through the same advice, same questions, same answers.
Yes. As Doctor mentioned, the future is bright. In this positive note, we come to the end of today's episode. Thank you very much, Doctor,
so much.
for spending your valuable time with us and clarifying all our questions. It was a very useful session. I hope all of you viewers too found this episode really useful. Until we meet in the next episode, this is Mareena Francis signing off. Stay healthy, take care of your health, keep happy, and good night.